Voorman is an ear, nose, and throat specialist who completed his residency in otolaryngology at the Geisinger Medical Center in Pennsylvania and a general surgery internship at the University of California in San Francisco. He is a graduate of the Keck School of Medicine at the University of Southern California and is a member of the American Academy of Otolaryngology. He holds a Bachelor's of Science degree from Calvin College in Grand Rapids, Michigan. Dr. Voorman has been a member of the Hutchinson Clinic since 2015. He has advanced training in endoscopic sinus surgery and temporal bone surgical dissections, as well as an advanced training in basic allergy and immunology. Dr. Voorman has also worked as a software developer for Anesthesia Consultants of California. He and his wife Anna moved to Hutchinson last year. I'm pleased to introduce Dr. Matthew Voorman.
Like I said, I'm named Matthew Voorman, and I'm here as a throat doctor. Here's that same stuff before. A little closer here. Is that better? A little better? All right. I'm a little taller than some people too, so just a quick starter comments here. I made this presentation. Initially it was kind of geared towards other residents and doctors in training. I didn't have to dumb it down too much for you guys. I figure you guys are pretty smart, so we got some doctor words in there. There's some stuff you don't need to know. There's some stuff that's interesting. I also have been through a lot of lectures in my training and career here, so I never really liked them very much. I put a bunch of pictures in here. If you're not the lecture type of person, just look at the pictures. It's going to go from there. So there's at least some amount of humor in here, and hope you guys like it. That's about where we already got that far. My topic is allergies and sinus problems. At least for the common person, allergies, sinuses, we kind of use those terms interchangeably sometimes. I'm going to kind of break them apart a little bit first, and then talk about how to treat them separately. The standard pictures of allergies or sinusitis, types like that. Always a picture of blowing the nose, it's usually a yellow field, and it's used a lot. In terms of why is this important, here in Kansas, top 7 in allergies, and I think sure a lot of allergies here, a lot of dust, a lot of factors, and so it's a big problem. Above average allergies here, actually average or below average number of allergies. So what are allergies? There's probably 5 big categories. I'm going to talk about just the first one. Allergic rhinitis, so allergies involving the nose. I'm not talking about rashes or asthma or things like that. They're all related. Some of these treatments don't overlap with those things, and these conditions often overlap. So people who have nose allergies or allergic rhinitis, hay fever, that sort of stuff, often have asthma, or they often have eczema or rashes. Some people have food allergies too, and there's a whole bunch of different topics we can talk about. So allergic rhinitis, a lot of times people call it hay fever. It's very, very common. I think I said 40 to 60 million people. It's probably almost nearly 100% here in Kansas. It's not caused by hay, it's not a fever, it's just allergies. So what are the symptoms of allergic rhinitis or hay fever? Most important, runny nose and nasal symptoms. So yeah, usually clear, watery drainage from the nose, itchy eyes, mouth, throat. Sometimes people have an itch in the back of their throat. You kind of almost want to try to scratch and kind of wrinkle your nose around. Those are very characteristic of allergies. Things like infections or colds usually don't cause those same symptoms. And then the other stuff like puffy eyelids, sneezing, and cough. Now, cough and stuffy nose, those can be from a lot of symptoms. So you can get cough and stuffy nose from food allergies, you can get those from viruses, dry weather, sinus infection, all of those can cause those symptoms, or just deviated symptoms. So if you look at symptom-wise, the top ones, especially the itchiness, that's the most diagnostic of being allergies. But a lot of the treatments do overlap. And why does this matter to us, or why do we care? Anytime you have allergies, you kind of have this progression or concern for getting things like sinus infections. So to differentiate a sinus infection from just allergies, allergies cause that congestion, the itchiness. Sinus infection is a blockage in the sinuses. And there's a cycle that goes on. So you get, I can point here, normal sinus that looks, this is the cheek sinus, normal lining here, normal nose. Something causes you to get swelling or blockage in the nose. So that could be allergies, cold, dust, drum, anything like that. The nose swells up, you get decreased drainage, and then you get infection in those sinuses. And the infection causes more swelling, you kind of get in that endless cycle there. And so we'll talk about the allergies, which are just kind of itchiness stuff, and then also the sinus problems, which are more the pain, pressure, congestion type stuff. So talking about sinusitis, this is a standard picture for sinus problems, complaining of pressure, pain in the nose, and everyone has this unhappy look. If you look at these pictures, none of these people have sinusitis. It is all complaining of their eyes. It don't look that good when they have a sinus infection, so there's no drainage. They don't look sick at all. They got their makeup on. Well, sinus infections, the question is why do I care about this one? It's extremely common. I've never met anyone who's never heard of a sinus infection or says, oh, I've never had a sinus problem before. Everyone's had probably at least one. About 10 to 30% of Americans get them each year, which is 31 million. They're expensive, 20 million office visits a year. These numbers are probably from the late 90s or the early 2000s, so they're even more common now. Direct medical care, $11 billion, and also people missing work or having ineffective days at work. So if you're feeling sick, you're not going to work very hard. So lots of direct costs and indirect costs to America. What are the sinuses? I think we all kind of know sinuses are in the face area and that sort of stuff. They're made out of the same kind of lining that's inside your nose. It's called respiratory mucosa. It produces mucus, and they're connected to your nose through little pouches, and they're kind of hollow spaces that are connected to small channels. The openings are very narrow, small channels, and one of the purposes of the sinuses is they have air inside of them and they drain mucus. And there's 4 of them. I have listed over there. It doesn't really matter to you guys what the name of them are. There's funnels, ethmoids, maxillaries, and sphenoids. The sinus type tissue also goes into the inside of the ear, and there's actually mastoid type tissue there as well, which is also similar to sinuses. You can get infections there as well. Here's another picture of what the sinuses look like. And they develop over time, so you start off with ethmoids and maxillary sinuses, funnels and sphenoid sinuses, so the 4 in ones, those don't develop until you're older. And it's not uncommon actually to even not develop all the sinuses, so some people have smaller sinuses or bigger sinuses. What do the sinuses do? They produce mucus and get infected. That's kind of our idea of what they do. The reason they're important for our skull is they seem to decrease the weight of the skull. So a solid skull bone would be very heavy. It also allows for the resonance of our voice. And so when you're stuffy or a sinus infection, your voice doesn't sound as good as it normally does. It's also kind of a crumple zone for car accidents or things like that. So it helps protect the face and the eyeballs and the brain if you do have any sort of trauma. And then there's some other kind of more advanced reasons. We think they help regulate the airflow and the temperature and humidity of the air. So when you breathe in through your nose, which is the normal way of breathing, it helps moisturize the nose. It helps bring the temperature up so that when it goes into your lungs, it's not dry and cold. And that's why people who can breathe better through their nose tend to do better than those who can only breathe through their mouth. What is sinusitis? So the basic definition term, it's inflammation of the nose and sinuses. And so it's anything that causes swelling or irritation in those areas. It usually is associated with increased mucus production, and then just mucus production by itself, if it gets blocked, you get the stagnating secretions that kind of fill up in the whole area. And then once you have a sinusitis with mucus and blocked secretions, then you can get another infection on top of that, either bacteria or fungus can kind of grow in the sinuses. Going to that slide before, you can get a little cycle where this keeps on going. It's very hard to clear up sometimes, so that kind of develops a chronic sinus problem. And those are a whole different set of treatments. In terms of what exactly is a sinus infection and how do we treat these things, there's been a lot of healthcare changes, and if you look in the past versus now, insurance companies and other managed care organizations have a lot more say in how we as doctors practice or what we're supposed to do. And so they kind of make more and more guidelines for us. These are all still guidelines, so they're not strict rules, but there's a general concept that is the closer you adhere to the guidelines, that's at least deemed as being a better doctor or more in line with what the insurance companies want. And so you'll see a trend towards doctors practicing more in this direction or using kind of terminology like this. So the most recent guidelines I have from 2015, and they're based on evidence, which means studies or medical studies, research projects, often done at multiple universities. It's very difficult to study some of these things, and it's hard to find an exact correct answer for everything. So these, again, don't apply in all situations. The other tricky part of them is they're practical for maybe an academic setting but they don't always make sense in a community setting. Lots of doctors and different specialties got together to work on these settings. Here's the first one. What is a sinus infection? And the word for that is acute rhinosinusitis. And they use the word rhino and sinusitis because this problem involves the sinuses, the cheek areas, the forehead, and also the nose as well. So it's very rare to have a sinus infection without nose problems at the same time. And what they define that as is purulent nasal drainage. So something has to come out of the nose, and then obstruction, facial pain, pressure, fullness. And so according to this definition, if you don't have any drainage, then it's not a sinus infection. That doesn't mean you're not miserable or you're not having trouble, but that's kind of where we're going from for all their research studies. In terms of clarifying those definitions of sinusitis is, for the first 10 days of having these problems, they call it viral by definition, essentially. So if you have sinus complaints, drainage from the nose, pressure, headache, that sort of stuff, we're going to call it virus for the first 10 days. If it lasts more than 10 days or you get this kind of got better, then it got a whole lot worse, then they're going to say that could be a bacterial infection. And the reason this matters is antibiotics kill bacteria, antibiotics don't kill anything for viruses. And so that kind of determines what the recommendations from insurance companies or just healthcare organizations, how we're supposed to treat this. Chronic sinusitis is a problem that lasts for more than 12 weeks. And that again goes to further treatment there. And these are just, again, recommended guidelines or definitions and how we're supposed to practice. And if you get a whole bunch of sinus infections, our guideline is how many is too many, 4 per year is too many. Most people say 1 per year is too many for them, but in terms of what's having a whole lot, it's 4 per year. So what causes sinusitis? Viruses, colds, that sort of stuff. Allergies, anything that makes the nose not drain real well. And so these sort of problems all seem to cause sinus infections. And you can have what I say like official allergies, which are allergens, we'll talk about those, or just irritants, so dust or dry weather or smoke or things like that, which aren't necessarily an allergy with an antibody and an antigen, but still cause swelling and irritation in the nose and still start that same cycle where you get swelling, congestion, blockage, and then infection. And here's the kind of a more complex analysis of that whole cycle, but the short answer is there's swelling, it gets blocked, you have impaired secretions. The nose no longer works correctly once it's blocked, so you get decreases in how the enzymes work, you get a change in the environment inside the sinuses, which then makes it able to be infected. Because the nose, by default, has bacteria living in there. It's not a sterile place, but normally they're kept at bay with your immune system. And when all those factors start changing, then the bacteria can start overgrowing and causing trouble. And this kind of gets an endless cycle. And so, this sort of thing from happening. And the goal is to break the cycle. And what we do is we control allergies, we control irritants. That helps at least prevent getting sinus infections. You can improve nasal function in some other ways, and you can address structural problems. And I'll kind of go over some of these details as well. And so in the beginning, starting with the allergies, and that's a major issue here especially, is how you control allergies. The easiest way or the most effective way, if it works, is avoid exposure. That sounds like, well, that's dumb. If you don't have the exposure to the allergy, you're not going to have the problem. Sometimes that's easier for some types of allergies, it's harder for some other types of ones. And then there's a bunch of allergy medications, and we'll go over kind of all the different categories. Most people who have allergies don't get away with just controlling exposure unless they only have a limited allergy. So most people who have allergies will be on medicine. In average in the country, people have allergies, about 1.5 medicines per person. So no one takes a half medicine, but it's pretty common to be on more than 1 medicine for allergies alone. And then you can also have immunotherapy. That's a topic of a whole nother lecture. And that involves either shots or sublingual therapy to kind of decrease your immune system's response to allergens. It's actually fairly effective and it changes the immune system overall. It does take time to work, so it's often a 3, 4, 5 year sort of plan to get things under control, and that's with often starting off weekly shots or weekly therapy. It works well for a lot of things, but there's some downsides, obviously. And I won't talk too much more about that, other than it's a great option for people with severe allergies who aren't getting enough control with medicines. So the first category of allergies, we break them into 2 types, seasonal and perennial. And so seasonal are related to a specific thing, perennial ones are year-round. Looking at the seasonal allergies, it's trees, grass, weeds, and molds. And different regions have different time frames. These are the general regions, or the general time frames for these allergens. And it often varies from year to year, so you can have an early bloom or a late bloom or things like that. And we have other factors as well. So starting at the bottom, mold is very temperature dependent. Some places, like on the coast, can have mold year-round. In places where it freezes, and this is talking about outdoor mold. The outdoor mold kills off in the wintertime once it starts freezing. and it starts back up in the late spring once it starts raining again. And so some people have allergies to one type. You can kind of tell if I have allergies all summer long, but in the winter I do great. Oftentimes that's a mold type allergy. Trees are the ones we're dealing with right now. Those are the blooming trees, and those happen usually in the early spring. They're the first thing to bloom. What's interesting about trees, and we've probably come across this problem ourselves, is there's actually male and female trees, and originally there's both male and female trees hanging around. The female trees are the ones with the flowers, or the female parts of the trees are the flowers and all the stuff that drops down and all those sorts of things. The big chunks that you have to sweep up or have problems, you know. And those are actually non-allergic for the most part. They're a nuisance for cleaning, and so probably about 50 to 30 years ago we tried to breed male trees which don't have all the flowers and droppings and don't have the same problems. Those are the trees that actually produce all the pollen. And so it's been a new problem where there's a lot of male trees that produce lots of pollen. They don't have any flowers, so people liked them back in the day, but the majority of trees that were planted in cities or at schools are heavy pollen producing trees, unlike the trees that produce the big flowers, like a magnolia. Those big flowers, those aren't allergic, it's the small trees. It's thought to be, it's actually a very local phenomenon, so just getting those trees out of your yard or things like that can make a difference. But in areas with lots of trees, it can cover the whole area. Grasses, we're all familiar with grasses around here. It tends to be a later spring and early fall type problem with those grasses. And there's a whole bunch of different types of grasses that can cause allergies. And then weeds, like ragweed, is probably the most common. Again, that happens in the later summer. And like I said, molds all year round. Going to perennial allergies, and these are often referred to as more of the indoor allergies. These are things you're exposed to all year round. So dust mites, pests, cockroaches, molds are the big ones. And bottom right, that's a picture of my cat. My wife does have some cat allergies. So. And we'll talk about how to control these things as well. These are all very common. No one likes thinking they have these things growing out in their house. So how do you avoid the allergens? Number one is avoid them by not being around them. Some of them can be some kind of silly. So stay indoors when there's bad pollen, and wear a mask, things like that. Try to avoid going places where there is significant pollen. For trees, a lot of the pollen comes out in the morning, so 5 to 10 a.m. is actually when those male trees release all their pollen, and they also release it at nighttime. So midday is often not quite as bad. Now the wind and other stuff can blow that around, so that can cause problems as well. And then trying to keep all those outdoor pollens from coming inside your house. So window fans, run the AC, stuff like that helps keep the outdoor pollens outside, helps keep them from coming inside. If you're hanging clothes up outside, like a towel or a sheet or any of the kind of larger laundry, that'll also collect pollens too. And you can bring all those pollens inside. Those are pictures of pollen masks. The one on the top right is an athletic pollen mask, so people are biking or running who have significant allergies. You can buy a kind of a high volume mask that allows you to breathe normally. It has replaceable filters. You can also buy disposable masks that help with pollen. And they're not particularly popular because most people don't like wearing masks around, but they are fairly effective for really severe allergies. You can also look to see what the allergy and mold counts are. And so if you're wondering, well, how do I know if it's a bad day? Should I stay inside? Should I go out to the park or whatever? You can look it up. This is the data from yesterday, April 18th. And you can look online to see where these are, and you can just Google mold and pollen counts. These are produced by an allergy association, and there's databases for data for all over the country. So right now we have very high trees, and we listed oak, mulberry, and ash as our main problems. Moderate grass, or moderate weeds, no grass, and no mold, right, or just low mold. When I looked last week, I had a little bit of mold, and again, it kind of fluctuates. The way they calculate this is they actually have these little discs, and they leave them out overnight, and they just count how much pollen they'll collect over 24-hour periods. So that's how they measure these things. And they can look under the microscope to see what kind of pollens they are. Indoor allergies, sort of a little bit easier. Again, a lot of environmental things you can do for these sorts of things. Again, keeping the windows closed, keep the outdoor allergens in. Cleaning frequently, especially with a vacuum that has a good filter on it. Hardwood floors are also helpful for decreasing allergens. Mite-proof covers, washing things in hot water help kill the dust mites. They say 130 degrees Fahrenheit is what you need to kill the dust mites, and they say wash it frequently. And then humidity is what's needed for both the molds and for the bed bugs, or not bed bugs, the dust mites. The dust mites, they get all their air or their water from absorbing from the air, so if it's too dry, the dust mites can't survive. And so too low, it's too miserable for yourself, it's bad for the nose, so 30 is kind of a minimum. Most people get kind of miserable in the winter, but if you can keep it under 50%, that seems to help. That can be done with a humidifier, also just running the AC in the summer will help keep the humidity down. In terms of vacuuming the house, like I said, hardwood floors are better, tile, things like that. Some allergens, like the dust mites, they're a fairly heavy allergen. They're kind of like the whole bug and the stuff that comes out of the bug. When you vacuum those, it kind of stirs up and then it falls back down. So you can vacuum your room, it'll be good to go, a few hours later. Other allergens, and particularly pet dander, like cat fur, it's a very, very small particle. It's the saliva that's on the cat fur. And so if you vacuum that room, they'll stir it up and they'll be floating in the air for hours afterwards. So sometimes vacuuming can make these things a lot worse, especially if you're going in a place that hasn't had a lot of exposure. And then the other thing to think about is, where do you spend most of your time? You spend most of your time in the bedroom when you're sleeping there. So it's at least 8 hours. That's 1/3 of your day there. So try to keep pets or other allergens out of the bedroom. If you're going to try to focus on an area to keep clean or keep low allergy, that's one of the best areas. Some people also have problems at work, and so there's things called like an occupational rhinitis, and so certain work exposures can help. A lot of times those are treated with masks. Like I said, pets, keep them out of bedrooms. Some people recommend washing the pets. That's my same cat about 4 years ago. It was a little smaller back then. We've tried to wash them, and I don't think it makes any difference, but they say it does decrease the amount of saliva on them. And there are some breeds that have less fur or less hypoallergenic. The textbooks always say recommend removing the pet from the environment. I've met very few people with allergies who are willing to get rid of their pet. Or if your spouse has the pet and you have the allergies, most of the time it seems like the partner is more likely to go than the pet. I don't even put that on the slide. That doesn't really work too well. If you're going someplace that has pets that you're allergic to, wash your hands afterwards, wash your clothes afterwards so you don't bring it back to your house. So if you're allergic to dogs and you're going to visit someone's house, get a lot of dog fur on you, just wash that clothes, don't get it circulated with all the rest of your stuff. Then there's a whole bunch of other irritants, and these you kind of have the same symptoms as allergies. Dust is probably the biggest one around here, and or just the clippings. When they're doing the harvest in the fall, there's just a lot of particles in the air. Those particles come into your nose, they irritate it. They set off the same chain of reactions, and a lot of the medicines and treatments that work for allergies will work for these type of problems as well, with the exception of the immunotherapy. So smoke, dust, perfumes, hairsprays, laundry detergents. Most people have allergies, especially if they have skin sensitivities, like a non-fragrance type of detergent will work better. And those, again, will work better for the nose and for the skin. Talking about how to treat these things, other than avoiding the allergens, which is effective but difficult to do, one of my favorite things to recommend for people is nasal setting rinses or irrigations. And this works for almost all types of problems. So it works for colds, it works for allergies, it works for dust, it works for a variety of things. And the idea is to help clear the mucus out of the nose and help the nose work better. Again, if you look at that cycle, clearing the mucus out of the nose, decreasing the swelling and congestion, allows the nose to ventilate better. And it removes the particles, dust, bacteria, viruses, everything, and decreases all the inflammation. The picture in the bottom left there, or bottom right, is a Neomed sinus rinse. And the way it's supposed to work is you squirt it in your nose, it goes up one side, around the back, and out the other side. It kind of washes the stuff out with it. Some people do it every day, every couple of days, multiple times per day, just when they're getting sick, that sort of thing. And it really depends on how severe your symptoms are. So, sometimes for a lot of people, especially people I know, when you get a cold, or if I get a cold, or I'm flying near future, you just kind of feel something coming on, you can use a saltwater rinse, but kind of clear stuff up so when you're traveling, you're not so miserable or whatever. It's a decent amount of nuisance to do the rinses every single day. You have to prepare them, you have to clean them up, and so that's why I don't do it every day. Some people find they get great benefit from that every day, and so they do it every day. Or the people who, if you're working out on the farm, or there's a lot of grass going around or dust in the air, doing it at the end of the day to help to clear out the nose and that sort of thing. And a lot of people get great benefit from that. There's a variety of ways to do it. We'll go over some of these things. In general, there's a whole bunch of different packages you can buy that do them all sorts of different ways. Whatever way works for you is probably the best way, again, because if there's one way that works really well and you're not doing it, it's not giving you any benefit. So the way that you can do is the best way. In general, more pressure is better, more volume is better. And so the more volume you get up there, and the harder you push it through, the better it's going to work. Sometimes just a mist is easier tolerated, however. And then there's a whole bunch of additives and ingredients you can put in there. Isotonic talks about how concentrated it is. If it's really strong, it'll draw water out of the nose. That's good for an acute infection, but in general, you want isotonic. And if you look on the packaging, they'll say those type of words. And that means it's balanced to the normal concentration of your body, so it won't make things swell, it won't dry them out, it just helps moisturize them. And then baking soda and other additives seem to help. The packaged ones all have baking soda, which helps decrease the amount of burn in there. And then we'll talk about some other additives from the next slide here. This is the one I recommend. It's Neomed Sinus Rinse. It's probably the easiest to use. You can buy a bunch of packets for it, and they cost about 10 cents a day for the packets. I don't have any financial motivation with this brand, unfortunately, so I don't get anything from them. You can make it on your own as well, and there's a bunch of these on the internet. And I think a lot of people's noses are different, so if you look and read around, different people have remedies that work better for them or what other people like better. This is from the Otolaryngology ENT website, and it's 1 quart of water, 1 teaspoon of salt, 1 teaspoon of baking soda. And there's other group people who say let's use 3 teaspoons of salt, no baking soda, or a quarter teaspoon of baking soda and 2 teaspoons of salt. It doesn't matter too much. You can adjust them to the concentration that makes sense for you and the amount of burn that kind of bothers you. So sometimes if it's too strong, it stings. This is kind of a good starting point. And there's a lot of additives you can try doing. A drop of apple cider vinegar, and a lot of people seem to think it helps a variety of conditions. It seems to make it sting a little bit more in the nose, but that can help with certain bacteria, viruses, and things like grapefruit seed extract, xylitol, and other essential oils. Some people like having a little bit of a flavor in there or things like that. In general, we want to start off really small. Don't put a whole bottle in there, it'll sting a lot. In general, they're not dangerous. It'll hurt if you do it too much. And if you read online, almost everybody has their own recipe of things they like to do in that area. And there's not good evidence of which is the best way, but like I said before, more volume, more frequent, more pressure tends to help. And we'll talk about medicine. So those are all the kind of, I don't know if easy is the right word, but those work for all sorts of circumstances. Medicine, we kind of have to tailor to what's exactly going on and what symptoms we're trying to control. And there's a whole bunch of different categories. And I'm going to go through the medicines that we use for all these problems, and I'll talk about where they're best for together. Antihistamine, this is the most common medicine. You're all familiar with it. These are generally available over the counter. They work right away, so you take an antihistamine medicine. Benadryl is one of the older ones. It also is sedating, so we don't like to use it very much. Zyrtec, Claritin are very common ones now. And what they do is they decrease your body's response to allergens or irritants. So they work for allergies, they work for dust. They work right away, so you take the pill, it works half an hour, hour later. Lasts for about 6 to 8 hours. It kind of depends on which ones you're taking. A lot of the ones you take today you can take for 24 hours, although sometimes you can take 2 doses if you want to. They have low side effects. Usually the biggest complaint is either dry nose, or if you're using the earlier ones, they cause sleepiness. It's like Benadryl, the stuff that's in NyQuil makes you sleepy, which is sometimes wanted if you are sick. So it's just, that's one to take at nighttime. In the morning time, if you're trying to work, don't take those ones. You can take them long term. There's no real risk of causing problems if you take Zyrtec every day. It doesn't cause a rebound problem afterwards. They're cheap, which is nice, and they're over the counter. Next one is the nasal steroid spray. This is probably the single best medicine for nasal congestion. So if you have a stuffy nose or your main complaint is my nose is congested, this is a good medicine to take. It has a gradual onset, unlike the antihistamine, which works right away. So this kind of medicine you have to take for weeks at a time to get an effect. And it works by affecting how the cells work and how they respond to inflammation. So it actually changes the cells and their response. That's why it takes a while. It changes the proteins that the cells make, and over time they become less sensitive. You spray it in your nose, and it has, in general, low side effects. The main problems are trauma to the nose, so it can irritate the septum, which is the thing in the middle of your nose. It can dry the nose. Most people complain of a bloody nose if they're going to stop. That's why they stop. It has a bloody nose. Some of them taste better than others, and if it squirts in your nose right, you probably will taste a little bit in the back. Flonase is probably the cheapest, most common right now. Nasocort's another one. Rhinocort's also good. Q-nasal, there's a whole bunch of different ones. And they're available over the counter. They're generally pretty cheap. They're a little bit more expensive than antihistamine pills. And so, again, they're on the order of about $20 for a month's supply versus maybe $5 for a month's supply for the antihistamines. We think you can take them long term. They do have a steroid in them. The advantage is the steroid goes to the nose, not to the whole body. It's a small amount of steroid compared to what your body normally produces, so it shouldn't cause problems that way. There's a theoretical risk of causing cataracts, and that's probably if you spray it in your eye more than anything else, and so try to avoid doing that. And again, these are over the counter. There are prescriptions available for them as well. Oral steroids work really well. They work very fast. They decrease inflammation. They decrease swelling. And the problem is they have a lot of side effects, and you can't take them long term, so that's why you try to avoid them. And that's the reason for using the nasal version of these. And these are also prescription. And they're typically, at least in my practice, used for people with acute infections that are really bad, trying to get something under control as a kind of short-term treatment or to get through something. And in terms of just having allergies or long-term suppressive therapy, not very good. I'm from California, and so I don't like the Giants. I'm from Southern California, so that's where I came from. Decongestants, I think you're all kind of familiar with these. They can be either a spray decongestant or a decongestant that comes in another medicine. If you're buying an over-the-counter medicine, it has the letter D afterwards, like AllegraD or Claritin D or Zyrtec D. That means they have a decongestant in it. And in general, I don't recommend them too much, at least for regular use. And so they can cause some side effects. They can cause some rebound congestion afterwards. So they kind of shrink down the nose, and the nose will swell up afterwards. That can happen after prolonged use. So you can kind of become tolerant or dependent to them. The other problem is they're actually getting harder to get. So a lot of times you have to show your driver's license to get that version of the medicine or things like that. And so in general, I say if you're having a real bad flare-up, you're going to go flying next week, you're going to go up the mountains, you need something to get through, whatever, that's when to use a decongestant. If we're just trying to control your allergies at baseline, probably not the best plan. These are generally over-the-counter as well, and overall pretty cheap. Nasal cromolyn is used mostly for allergies. This works less for viruses, probably less for dust and irritants too. And it's a preventative medicine only, so it doesn't help anything once you've got the allergies or the swelling. It works by helping stabilize the cells so they don't release their histamines afterwards. And you spray it in the nose. It's low side effects, can be taken long term. It's cheap and over the counter. Overall, not very popular, again, because you have to take it very regularly. And it seems like the nasal steroid sprays work better. So most people, if they're using one spray, they're using nasal steroid spray. There's some people who are really miserable, so they might be on 4 or 5 medicines. So this is one we use. It is over the counter. Nasal Crom is probably the most common brand of it. It's probably the best use, which is uncommon for persons who have a very specific allergy. Oh, I have a cat allergy and I'm going to my grandkid's house who has cats or whatever. Use the spray before you go there. It'll work for 4 to 6 hours to kind of prevent the allergies during that time period. But then you don't use it afterwards. Next one is Nasal Anticholinergics. These are also, they're effective but only for some certain circumstances. Rather than the congestion, they tend to work on the secretions. And they just decrease how much mucus your nose produces. You can have pill versions of these ones which have a lot of side effects and dry you out. We use them for other circumstances. They're prescriptions, so they're a little harder for you to decide to use on your own. And they decrease the runny nose or the drippy nose. They're best for the person who's complaining, I have a really drippy nose all the time. And they also work for people, not just from allergies, but if you have the kind of nose where if you get over a warm plate of soup, or it's kind of smell the food, it kind of the nose waters at the same time as the mouth waters, it works well for that one as well. You can take it long term. It's a safe medicine. Main risk is if you get it in your eyes, it can cause blurry vision. That's a temporary problem, but it can actually really blur them up pretty good. And like I said before, it's prescription. BuccalEnix, I think we all heard of Mucinex. This works very well for colds or trying to clear mucus. It actually makes you have more mucus. It's just waterier, so it's kind of the opposite of the last medicine. It turns your thick, dry mucus into kind of watery mucus. And the idea is it's easier to blow out your nose or cough it out of your lungs. And so I usually don't use this medicine for kind of long-term use. Again, it's just when you're having a cold or having trouble, it's a good medicine to help kind of clear stuff out. It makes it easier for your nose to clear the mucus out, which is how it's supposed to work normally. Some people get side effects from these, and it's often paired with other stuff, like this package over here says Mucinex DM. The DM means dextromethorphan, so it means it has an anti-cough medicine in it too. It's cheap, it's over the counter, again, it's relatively safe. Some people get confused by it or can cause kind of some weird personality changes, but they're not dangerous. We'll go to the next category, antibiotics, and we're all familiar with these things, and there's a whole bunch of different types. Some of them work faster than other ones. What they do is they kill susceptible bacteria. They don't kill viruses, they don't kill allergies. Depends which antibiotic you use, which allergies you have, or which symptoms you have, how fast or how well it works. One of the main downsides is that you can develop resistant bacteria, so it only kills the bacteria that this antibiotic can kill. And a lot of times the nose ends up getting left over with the kind of mean, difficult to kill bacteria. the nose does have bacteria normally, so it should have some healthy bacteria or kind of like those probiotic type stuff. So oftentimes if you're on a lot of antibiotics, you've killed off all the kind of the easy ones and you're left with the mean ones. Price varies, obviously it's a prescription only. And I don't talk about it in this slide or presentation too much, but there's also the option of doing kind of topical antibiotics for the nose, either creams that go in the nose that have antibiotics in them, or putting antibiotics inside the whole saline rinses. Those are effective, although we don't do them too often. They're kind of for certain circumstances. So going over how do you treat infection, number one is symptom control. And kind of talk about those medicines. So you treat the irritation, you treat the congestion, you treat the infection, you treat thick mucus. And that should hopefully break the cycle. Depending on the severity, you try to break all the cycles. And the question a lot of people have is when do we get into antibiotics and all that sort of stuff. So going over the different categories, viral sinusitis, we call it the head cold. This is the first 10 days of having those sinus infection definitions that we talked about. There's no cure for the common cold. There's no antibiotics that fix it. And you treat the symptoms like we talked about. So I have steroid sprays, saline irrigations, pain relievers like Tylenol, those sort of things. And antibiotics are not recommended. And the reason they say that is only about 0.5 to 2% of these head colds turn into a bacterial infection. Again, those are from studies done at kind of the academic centers. So some people, that's kind of all come, or some people are like, well, I know this one, it's starting, it's going to turn into a bacterial infection, I kind of know that sort of thing. So some people do know kind of what's going on, we don't always follow these rules here. The next subset is the bacterial rhinosinusitis. And again, do you get antibiotics or not? You know, it might be a little surprising to say one option, or they're almost recommended options, just to kind of watch them and see what happens. About 70% of bacterial infections will clear up on their own, so even though you kind of got the bacteria in there, had the kind of green, yellow drainage, had the fever, pain stuff there, they still got better on their own. You still treat the symptoms with the saline sprays, the steroids, the pain relievers, and things like that. And you can optionally give antibiotics here. What a lot of people said or a lot of the academics kind of recommend is maybe giving you a prescription, watch for a few days, see if you get better, and then start the antibiotics. They often said watch it for a week to see if it gets better on its own. And I don't necessarily like the idea of waiting a whole 17 days of being miserable till you get antibiotics. So you know, wait the first 10 days to call it a bacterial infection, and wait another 7 days to see if it goes away on its own. So that's not necessarily what most people want or get. And so even though this is kind of what the recommendation says to do, these are recommendations in terms of what's going to cause problems for you in terms of getting bad complications from sinus infections. Doesn't necessarily mean you won't be miserable or not for those 17 days. And so a lot of people do get antibiotics earlier. But this is probably a shift that you'll slowly notice that more and more doctors are encouraged to, well, did you try waiting to see if it goes away type problems. And so that's probably coming down the line where insurance companies are kind of monitoring doctors or pointing out, well, it looks like you give a whole lot of antibiotics right away, and they recommend, why don't you try waiting there. Again, these aren't mandatory, but they're just kind of a general trend. Next category is chronic sinusitis. So these are sinus infections that last more than 12 weeks. You've tried antibiotics, they've never up. And in order to prove that you have a chronic sinus infection, usually requires some sort of CT scan or imaging study to kind of show there's blocked sinuses that haven't cleared back up. And these often require surgery. So like I said, if they last 12 weeks without getting fixed up, we kind of think, well, we've given medicines a good try, they haven't figured out how to clear up the problem, maybe we should go ahead and do a surgery or something else to fix this problem. I tell people these are usually a nuisance problem, so if they're causing enough symptoms that's bothering you enough, then maybe we should do a surgery. If you're like, well, yeah, I have some pressure and drainage all the time, but it doesn't bother you that much, maybe you don't necessarily need a surgery. It's a very common surgery to do. I'll talk briefly about these. There's kind of two new ways of doing it. So there's one I call functional endoscopic sinus surgery. It's performed through the nose, remove bone. It's done while you're asleep. I can address all the sinuses that are in the nose. I can address the septum and the turbinates and other things at the same time. And this has been done probably since about the 80s. And then before the 80s, they actually did it through the nose in a slightly different way. It's done with hollow telescopes and kind of rotor-rooter type devices. I use a TV screen so I can kind of watch what I'm doing while I'm doing the surgery. And this is a picture of what it looks like in residency. So there's a doctor, there's probably 2 people watching, and that's probably the most common way it's done. Again, that can kind of work for everything. It's done with you asleep. The newer way, or the more marketed way, is the balloon sinuplasty. It's also performed through the nose. Instead of using the rotor-rooter device to kind of chew up the bone and kind of clear up and make nice big holes. It uses a balloon to stretch out the natural holes. And the idea of that is instead of taking out bone and leaving raw areas, it makes the hole bigger, but doesn't leave a raw surface, so the healing is a lot faster and the recovery is quicker. The other advantage is since it's not that much pain associated with it, it can often be done with people awake in the office or under minimal sedation rather than going to sleep with a breathing tube or things like that. It can't address every single sinus. It's mostly the cheek sinuses, the forehead sinuses, and the ones way on the inside of the head. Can't work on the septum at the same time, so if you have a very deviated septum or things like that, that can't be fixed as well. And it's a basic simple design here. There's a device that threads a catheter into the affected sinuses. The balloon stretches the hole open, and then while you're there, I kind of rinse it out. This can also be done with people asleep, so it doesn't have to be done in the office. And it's becoming a more and more common procedure. This has been around for about 10 years, and it's been probably popular for the last 5 years. And it's relatively new, so it's harder to know how long does the surgery last in terms of recovery. We think that if you take out the bone and make a nice big hole, that should stay open for a long time. If you stretch out the hole, it's kind of similar to when they do the cardiac cath stents where they kind of dilate the arteries in the heart. They're certainly prone to kind of shrink back down again. So some people have found they've had to do this multiple times. The advantage is it's a relatively quick procedure for you, and it's not too painful, not too much of a downtime. It is a marketed procedure, so the people who make the devices that we use, they try to advertise this procedure, so there's lots of marketing materials for this one. For the other one, there's less marketing, so you probably won't hear about that one as much. To kind of compare the two, is one's removing tissue, one's stretching the holes open, and then the downtime and the pain. And so the balloon has a lot less pain and downtime for most people. And then the other surgeries we can talk about are straightening out the nose, which is the septum in the middle, or shrinking out the turbinates. Again, straightening out the septum can't really be done while you're awake. But if you have a big deviated septum or you have large turbinates, those things can make you have not very much room in the nose. So any small amount of swelling or allergies or irritants doesn't give you as much room to have those sort of problems. So a lot of times, working on these things as well helps control the allergy symptoms to help make you tolerate your allergies a little bit better. And this should be about the end of it. And let's see, this is the kind of picture when, if you look at marketing websites, this is what everyone looks like after the sinus surgery. They usually breathe really nicely. And again, she doesn't look like she just had sinus surgery either. So, that's kind of a standard picture there. Look here. A lot of questions here.
Yeah, so we're going to take a few questions. And so yeah, if you have one, just raise your hand and I'll bring the mic over to you. We got one up front. We got one right here in the middle. And just a heads up too, we're going to have this video on our website, touchregional.com. You can find it and review everything.
Yeah, I talk really fast, so you can always watch it in slow-mo later.
I don't always know whether I've got a sinus infection or a cold or what it is, but I know I have trouble sleeping at night. I take a product called Afrin, but I don't know where it fell into your category, but it says do not use more than 3 days, or it can make the situation worse.
Yep.
Can you comment on that?
Sure, Afrin, it's a pretty common medicine. It's a nasal decongestant. So what it does is it decreases the blood supply to the nose, and it makes everything shrivel back up. It feels great when it's shriveled back up. The air flows really nicely. The downside is when the inside of the nose is shriveled up, it doesn't get good blood flow. So the little cilia that are lining the nose, a lot of times those get damaged temporarily. They stop moving, they stop sweeping the mucus around, and once the nose gets its blood flow back, it's not working quite as well as it was before. The next problem is the nose can get so almost dependent on that, where the brain actually sends signals to the turbinates or the things inside the nose to swell up or congest, and there's some amount of stimulation that to keep them shrunk down somewhat. If you're using the medicine on a regular basis, they end up getting so dependent on that medicine, the brain kind of shuts down the signal. And so what happens is after you stop taking the spray, or after the spray wears off, it gets more congested than it would have been before. And so that's a pretty common problem. So it's a good medicine if you're flying or getting a cold or something. A lot of times you have the medicine, you need it all the time, so you take it and all of a sudden it wears off. 12 hours later you need it again, and that sort of thing. So what I tend to do is get people off that medicine by switching them to a nasal steroid spray in kind of a gradual fashion. Because if you quit it cold turkey, you're really miserable for a while.
I have what I call chronic sinus drainage. It's 24/7, 365 days a year. It's not any worse than it was one time.
Mhm.
I don't have any trouble with runny nose or anything like that.
Just all on the back.
It's all on the back, and when I lie down at night, a lot of times, it makes an itch, you know, in my throat, and then I cough, and is there anything else best for that?
Hard to say for sure. When I see people in the office actually use a camera to look inside their nose and the back of the throat area to kind of see what everything's looking like. If people have a lot of mucus drainage, one of the things that works great is a sinus rinse, is just to help clear the mucus out. If you're having the problems at nighttime, rinsing that all off before you go to bed helps clear out the nose, so you're not having all that drainage back there. If it's from certain sinuses, sometimes you can treat those with other things. If it's from allergies, there's certain things to do for the allergies.
I was wondering, do most of these medications, do they have eye problems like glaucoma?
Some of them do. The one I mentioned that can make you have the blurry vision, the Atrovent can sometimes cause eye problems. The nasal steroid spray usually doesn't. Some of the antihistamines, they can put those off as well. But the nasal steroid spray is probably a good medicine for that. Like I said, it does have a risk of cataract formation, but it's usually not a glaucoma medicine.
All right, I'm going to take one more question here, and then you guys can see Dr. Voorman up front, and maybe he has a little time to answer a few.
On the balloon plastic, does that have a mesh?
No, so like we have balloons with meshes or stents to keep things open. What this balloon does is it stretches out the hole or the ostium. The ostium actually has some bones in it, so it kind of cracks and crunches those bones. So the thought is those then heal back where they are and hopefully keep it open. So we don't put little meshes or stents to keep things open. There's a new product that we're working on that actually is a dissolvable mesh or stent. It's filled up with steroid, and so the idea is to leave that mesh or stent inside the nose, let it dissolve and release medicine over time. It's not covered by insurance yet. It costs about $1,000, so we're not using them yet. But the idea is a good idea, so maybe in the future, not yet.
All right, well, thank you everyone for coming, and let's please give Dr. Voorman a hand.